Dr. Issa, your OBGYN on call. Whether you're a returning viewer or you're new here, welcome to our channel. This channel explores the nuances of sexual wellness and empowers you on your journey to a healthier sex life. Click on the subscribe button below to stay updated and gain valuable insights about your sexual well-being. Today, our focus will be on a subject that affects many individuals and couples on their journey to parenthood, and that is infertility. If you've found your way here, it may mean that you are planning to conceive and it hasn't unfolded as expected. If this scenario resonates with you, remember that you are not alone and that seeking help and guidance is totally okay. In this video, I'll walk you through the common causes, the available treatments, and other steps that you can take to enhance your chances of welcoming a little one into your life. But before we delve into the topic of infertility, let's first take a moment to understand the fundamental concept of fertility. Fertility is defined as the capacity to reproduce, and it is also defined as a natural capability to conceive or induce conception. Being fertile means that your body can easily work through the process of fertilization, where a sperm cell and an egg cell join together to become an embryo. In a group of normally fertile couples, the monthly ability to get pregnant or fecundability is only around 20%. You might already remember how fertilization works from your science or health class, but let's go through it quickly right now. For a more comprehensive understanding, I recommend checking out a previous episode where I talk about the menstrual cycle phases. You see, female individuals go through several menstrual phases in their menstrual cycle, and one of them is ovulation. This is when the mature follicle will release an egg cell where it is swept into the nearest fallopian tube. And this egg cell will only live for up to 12 to 24 hours. If there is sperm that is present during ovulation, then this egg can be fertilized. The fertilized egg will then develop into an embryo where it will now travel from the fallopian tube into the uterus. After ovulation, the endometrium or the lining of the uterus prepares itself for the impending implantation of the growing embryo. A few days after implantation, the embryo now produces beta-HCG or the human chorionic gonadotropin, which is what makes the pregnancy test positive. When both partners in a heterosexual relationship are fertile, then this process can happen naturally through vaginal intercourse as long as they're not using any contraceptives. But for people who are experiencing infertility, it's a completely different story. Specific conditions can hinder them from successfully completing the fertilization process, consequently impacting their ability to achieve pregnancy. Now let's discuss what infertility is. The term infertility is generally used to indicate that the couple has a reduced capacity to conceive. According to the World Health Organization, approximately 1 in 6 individuals are impacted by infertility. This statistic emphasizes that the challenge is a global concern, and it's important to recognize that you are not alone in facing it. There are 2 types of infertility. Number 1 is primary infertility, where you have never been pregnant before and you are unable to conceive after 1 year of unprotected intercourse. Number 2 is secondary infertility, where you have already successfully conceived and given birth, however, you find yourself having difficulty conceiving again. Infertility can be caused by several conditions. The first category would be ovulatory disorders, and this would account for around 20 to 40% of cases of infertility. Common conditions like polycystic ovarian syndrome or PCOS falls under this category. PCOS can disrupt the regular release of an egg from the ovary due to hormonal imbalances. It often manifests as having irregular periods, having anovulation or a lack of ovulation, excess androgen production, insulin resistance, and having multiple follicular cysts in the ovaries. These irregularities can make it very difficult to conceive. Another medical condition under this category would be primary ovarian insufficiency, where your ovaries stop functioning before the age of 40 years old. The cause is often unknown, but factors associated with primary ovarian insufficiency include the following, like immune conditions, exposure to radiation and chemotherapy treatments, or even genetic conditions like Turner syndrome. The second category would be tubal disorders, where they would account for around 30 to 40% of cases of infertility. Under this category of tubal disorders, medical conditions like salpingitis is included. This refers to the infection and inflammation of the fallopian tubes, leading to scarring, adhesions, and even blockage of the fallopian tube itself. When the fallopian tubes are damaged, they cannot facilitate the transport of the sperm and an egg together or the fertilized egg into the uterus, and this presents a barrier to a successful conception. The next category would be the male factor, which also accounts for around 30 to 40% of cases of infertility. Male factors explain or also contribute significantly to infertility. A semen analysis is actually a very important step to evaluate infertile couples. Another category that explains infertility would be uterine disorders. Under uterine disorders, medical conditions like myomas or uterine fibroids, adenomyosis, endometriosis, endometrial polyps, and even Müllerian anomalies are under this category. Uterine fibroids or myomas are non-cancerous growths in the uterus. They develop from uterine muscle tissues and they develop in the myometrium, in the serosa, it can even be in the cervix or in the fallopian tubes and all around. These fibroids can be as small as a coin or even as big as a melon. These fibroids can cause infertility as they can distort the anatomy of your uterus. The change in the anatomy of the uterus due to these fibroids can either obstruct the implantation of an embryo or even block the fallopian tubes. Endometrial polyps are non-cancerous growths in the endometrium that can also hinder implantation into the uterine lining. Endometriosis is a medical condition where tissue that is similar to the lining of the uterus or the endometrium grows outside of the uterus. This can cause adhesions and distortion of the pelvic anatomy, and it can cause blockages in the fallopian tubes and really just affect your fertility. Adenomyosis is similar to endometriosis, wherein the tissue that is similar to the endometrium can be found in the myometrium or the muscle of the uterus. Lastly, we have Müllerian anomalies. Having a congenital anomaly of the uterus can increase your risk for pregnancy loss or miscarriage, fetal malpresentation, and even preterm birth. And finally, the last category would be the unexplained infertility. This accounts for around 10% of cases of infertility. Unexplained infertility is a diagnosis of exclusion. This means that after a systematic evaluation, the different tests failed to identify a cause for the infertility. So in addition to these categories, gynecologic cancers can also be a cause for infertility. The different gynecological cancers are the following. So you have cervical, uterine, ovarian, vaginal, and vulvar. Not only can the cancer cells damage the reproductive organs, but the available treatments also can severely diminish your reproductive capacity. Some gynecological cancers require a surgery to remove the cancer cells. Some individuals may be recommended to undergo a total hysterectomy where the uterus, the fallopian tubes, the cervix, and even the ovaries may be removed. Adjunct treatment like chemotherapy and radiotherapy can also cause some damage to the ovaries, which can also reduce the person's chances of getting pregnant. These are some of the usual reasons that a couple might face when they are having difficulties getting pregnant. This is a reminder that everyone's situation may be different and that there may be various factors that come to play when it comes to infertility. Let's now move on to how infertility is diagnosed. Remember, only your gynecologist or your healthcare provider can diagnose infertility. It's not something that you can just assume just because your period is late or you're having menstrual cramps and you can't conceive. It's best to consult if you were unable to conceive after 1 year of unprotected intercourse, or if you are over 35 years old after 6 months of unprotected intercourse. They may also ask if you've had previous pregnancies before or even miscarriages, if you've had previous surgeries like abdominal or pelvic surgeries, and they may also ask if you've had sexually transmitted infections prior. It's also important to emphasize the symptoms that are related to your reproductive organs like irregular menses, profuse vaginal bleeding, or even abnormal discharge. Following the initial consultation, you may undergo a series of assessments. This may include the pelvic exam, a physical examination, and even a pelvic ultrasound. In a previous episode, I covered some of these tests and I discussed what happens in your first gynecologic visit. You can find the link in the description box below. You may also need to do other blood tests like ovarian reserve testing, tests for ovulation, endometrial biopsy, and other blood tests like thyroid function test, fasting blood sugar or HbA1c, hysterosalpingogram, other hormonal tests, and imaging. Your partner may also need to undergo a semen analysis, as I previously mentioned. Okay, so imagine someone consulted a specialist and they realize that they're facing infertility. What happens next? What's the next step? Or what are the possible treatment options? So in this next section, we will explore the possibilities. The first category of treatment options are your fertility medications. Fertility medications are designed to regulate or stimulate the reproductive system. This can address specific issues that hinder conception. Depending on the case, an individual may be prescribed with ovulation induction drugs like clomiphene citrate or letrozole. These medications influence the hypothalamus and the pituitary gland, which are situated in the brain. They prompt the release of hormones like the GnRH, FSH, or LH. These hormones play a crucial role in stimulating the ovaries to produce eggs. There are also some who use injected hormones to stimulate ovulation. Some of these hormones include the following. The next category of treatment options would be the assisted reproductive technology. This collective term covers a range of procedures that help people with infertility. Here are some of the procedures that are under ART or assisted reproductive technology. The first would be in vitro fertilization or IVF. The process starts when a fertility specialist retrieves eggs from a female patient and manually combines it with her male partner's sperm in a laboratory. Once the egg is fertilized, the resulting embryo is now implanted back into the female patient's uterus. A successful pregnancy follows once the embryo implants itself to the uterine lining. Next would be intrauterine insemination or IUI. This is also known as artificial insemination. The process starts with the fertility specialist collecting a sperm sample and performing sperm washing. Sperm washing removes the debris and unhealthy sperm from that sample. After that, the doctor will now insert a catheter through the cervix and into the uterus, where they can now directly place the washed sperm into the uterus. It allows the sperm to bypass the vagina and the cervix, giving it a head start to get to the egg for fertilization. Next would be the intrafallopian transfer. It shares some similarities with IVF, but the process is a bit quicker. Fertilization occurs inside the body, which is what's different with IVF. There are 3 kinds of intrafallopian transfer, which are the following. The next would be a frozen embryo transfer. In this procedure, frozen embryos resulting from an in vitro fertilization are thawed and are now implanted into the uterus. This occurs strategically in the menstrual cycle to optimize the conditions for a successful pregnancy. And next would be the intracytoplasmic sperm injection or ICSI. It is a specialized procedure commonly performed in conjunction with IVF or in vitro fertilization to facilitate the fertilization of an egg. In this procedure, a fertility specialist will take a single live sperm and inject it directly to the center of the egg. The fertilized egg will now continue to grow in the laboratory for 1 to 5 days, and then it will be transferred to the uterus. The last category for treatment options would be fertility surgery. Fertility surgery tackles issues like polyps, fibroids or myomas, scar tissue, or adhesions. For example, if there are problems in the uterus or the fallopian tubes, then you can do a diagnostic or therapeutic laparoscopy. So this procedure is performed under general anesthesia, and your doctor will make small incisions where they will put the laparoscopic instruments. So these instruments have a small camera inside them, and you can also put some tools that you can use during this surgery. This will allow the removal of adhesions, lesions, fibroids, polyps, or even damaged fallopian tubes, which also contribute to infertility. In this final section, let's talk about your fertility preservation methods. Even in the absence of specific reproductive conditions, some females may still have fertility concerns. Some of these challenges are due to cancer, autoimmune diseases, or other health conditions. Social concerns like looking for a partner and also furthering your career are also barriers to building a family. However, age is a significant factor that affects fertility. As quoted from the American College of Obstetricians and Gynecologists, fertility starts to decline once a female reaches 30 years old. The decline happens much faster when you are in your mid-30s, and by 45 years old, fertility has declined so much that getting pregnant naturally is unlikely. And this is why some females choose to do fertility preservation to protect their ability to have children later on. These are the fertility preservation methods that are available. This allows individuals to pursue family building when they're ready. In this process, the eggs are extracted, frozen, and stored for later use. When a female is ready for conception, then these eggs are thawed and then they are fertilized and then implanted into the uterus. Next would be embryo cryopreservation. This involves extracting an egg, fertilizing it with a sperm, and then these embryos are frozen and stored for later use. When ready for pregnancy, then these embryos are thawed and then implanted. Next would be ovarian tissue freezing. A small piece of ovarian tissue containing immature eggs is removed and then frozen. In the future, the tissue can be transplanted back, allowing for natural conception. And lastly, ovarian transposition or oophoropexy. This is for individuals undergoing radiation therapy. The ovaries may be surgically repositioned in the pelvis to minimize the radiation exposure. This is done to protect the ovaries from the direct effects of radiation. However, due to scattered radiation, complete protection is not guaranteed. And that ends our insightful discussion. As we conclude our discussion on infertility, I want to leave you with a message of encouragement. Facing infertility can be challenging, but I guarantee you that you are not alone in your journey. There are now various options and technologies and support that are now available to help you go through it. If you found this video informative or think that it might help someone that you know, then please consider sharing this. Your support could make a significant impact on someone's life. Make sure that you never miss out on our future explorations of important topics in sexual health. And if you resonate with our content, remember to give it a thumbs up. Your likes and shares contribute to building a more supportive community. Until next time, everyone, take care and stay well. Bye!